Migraine is defined as a set of symptoms, including headache. Its characteristics are as follows. The pain occurs in episodes. It often sets in gradually. Rather than suddenly, it can last from 2 hours to 3 days. If left untreated, it is often pulsatile, feeling of heart beating in the head, hammer blows, but can sometimes be felt as a tightening or crushing sensation. The intensity of the pain is increased by physical exertion, walking, climbing stairs, etc. The pain can be located in the forehead, on both sides or on one side only, right or left, and the side can change. The pain is often moderate to severe in intensity. It is often associated with nausea, vomiting, or sensitivity to light and noise. Migraine is a complex condition with genetic and familial causes, but also external factors such as fatigue, sleep disorders, stress, nervous tension and muscle tension, hormonal fluctuations such as those associated with menstruation, missed meals, strong odors, bright light, heat, dehydration, caffeine, etc. People who suffer from migraine often have a brain that is more sensitive than others to changes in the outside world, and may find it difficult to adapt to all the information it receives. It tends to respond by triggering inflammatory mechanisms and abnormal, temporary changes in blood flow. A migraine attack may be preceded by what is known as a migraine aura. These are abnormal sensory phenomena, seeing flashing spots, blurred vision, hearing whistling sounds, tingling in part of the body, numbness, etc., that are temporary and may stop when the headache begins or persist even after the headache starts. Some attacks may also be accompanied by loss of strength or speech disorders, which are also temporary but can be alarming. Treatment for migraine attacks is most effective when administered quickly, ideally within the first 10 minutes of the attack. Anti-inflammatory drugs, ibuprofen, are often more effective than paracetamol or acetaminophen. Sometimes it is useful to consider other, more specific treatments to reduce the number of attacks and the irritation they cause to the brain. To reduce the frequency of attacks, it is possible to act on the triggering factors. Improving and regulating sleep patterns, meals, hydration, physical activity, and better management of stress and emotions generally help to reduce migraine episodes. Hypnosis and learning self-hypnosis are part of preventive treatments. When it comes to migraines, there is a lot of work to be done to help the brain function in a more relaxed way and better manage all the information received by the 5 senses, as well as stress and emotions.